Welcome to Anatomy Coloring Book, page 65, the muscles of the foot. Intrinsic muscles of the foot. This is Dr. Stephen Harkins. Intrinsic, meaning within. The origin and insertion of these muscles all lie within the foot. Previously, we had talked about some muscles that were extrinsic to the foot. They originated on the tibia or the fibula or the interosseous membrane, and they terminated or inserted in the foot. But these muscles all originate and insert in the foot, the small intrinsic muscles of the foot. Let's start with the dorsal surface of the foot, or the top of the foot. The dorsal surface. Let's start with the extensor digitorum brevis. Well, extensor, what does that mean? Extending. This muscle is going to extend the digits, and it's short, as opposed to the extensor digitorum longus, which is one of the external muscles we already talked about. But extensor digitorum brevis. Here's the dorsal surface of the foot. Dorsal, meaning the top of the foot. Think about a dolphin, and the dorsal fin on a dolphin is on the top of a dolphin. And here we have the extensor digitorum brevis muscle. And you can see that the tendons, of course, extend to the digits, the phalanxes of the foot. Now the origin is the dorsal surface of the calcaneus, or the top of the calcaneus. And you can't see it here, it's not drawn here. This is only the bottom of the foot there, or the plantar surface of the foot. But right in here, so the calcaneus would be in this region back in here. Of course, the talus, the head of the talus comes out like so, but there is a little part of the calcaneus that comes underneath, right around in this area, and the origin of the extensor digitorum brevis will reach back and originate at the calcaneus there, and of course it inserts up here at the middle phalanx, the middle bone of the toe, the intermediate phalanx. Of course, the job is to pull those toes back and up, to dorsiflex the toes, or to extend the toes. The extensor hallucis, some people say hallucis, I think, hallucis brevis, of course, the short little muscle inside the foot that extends the hallucis. What did I say hallucis is? The big toe. And the tendon comes all the way up here to the proximal phalanx of the big toe, the first phalanx. And of course, when it contracts, and of course it originates along with the extensor digitorum brevis on this little part of the calcaneus that's underneath this retinaculum here. So it goes deep under and originates here on the lateral side of the calcaneus, dorsal calcaneus, and inserts. This is O, origin, this is insertion, and inserts right here on the base of the proximal phalanx of the big toe. Of course, if this muscle were to pull in this direction, it would extend, it would pull the big toe up and back. And so it would dorsiflex the big toe. That's the extensor hallucis brevis, reminding you also that we are on the dorsal surface, or the top of the foot here. Our next muscles we'll be looking at are on the bottom of the foot. So as far as the intrinsic muscles of the foot, there are only two on the dorsal surface. Now let's move on to the muscles on the plantar surface of the foot. In other words, the bottom of the foot. As you can see, there are many more, and it's a little more complex. But let's work in terms of layers. Let's take off the first layer right here, the superficial, the outermost layer. If you were to massage the bottom of a foot, these would be the first muscles you would come in contact with. So the first layer here, let's deal with the first muscle called the Abductor Hallucis. Well, hallucis, big toe, right? And abductor means to move away from the midline. So here is the Abductor Hallucis right here, labeled W, and you can see it running along the medial side of the foot, and it is originating underneath the, right here, underneath the calcaneus, on the inferior surface of the calcaneus, and then running along the medial side of the plantar surface of the foot and inserting at the big toe, right here at the medial portion of the big toe, like this. And you can see that if this muscle were to pull down in this direction, it would cause this toe to come inward. And that's into abduction. So the origin is the inferior calcaneus. The insertion is the base of the first phalange of the big toe. And the action is to abduct the big toe. A lot of times this muscle becomes very weak, and you know, many people, maybe you have yourself, have a bunion where the toe, big toe points inward. Of course, very weak and stretched out abductor hallucis is involved there. Now, the next muscle on the first layer is this muscle on the outside of the foot. Here's the pinky toe of your foot right here. So the muscle on the outside is the abductor digiti minimi. So what do you think it does? It abducts. Minimi means small, right? The small toe, the digit, the small digit. So it abducts the small digit. It originates also from the calcaneus, you can see over here, and then inserts here at the base of the proximal phalange of the fifth toe. So here you can see the abductor digiti minimi. You can't see where it originates, but it originates under here in the calcaneus, or under here probably. Back here looks something like this. And if it were, and then it inserts up here at the base of the first phalange. You can see if it were to pull this direction, this toe would come outward, because it's kind of on the lateral side of the foot. So it would abduct the little toe. So here it is. Here's the origin over here. Here's the insertion at the base. And then the action is to abduct this little toe outward. And spread your little toe outward. Pull, here's the midline here. Right? Going to take the pinky toe away from the midline. Whereas the Abductor Hallucis will take the big toe away from the midline. Abduction. Now, the most prominent muscle on the bottom of the foot, right smack in the middle of the foot, is the Flexor Digitorum Brevis. What do you think this muscle does? Flexor Digitorum Brevis. It's a short muscle, brevis, involved in the digits, or the toes, or the phalanx, the phalanges, and it flexes them. So here it is right here. Why? The Flexor Digitorum Brevis. Note how the Flexor Digitorum Brevis, like I said, it's a meaty muscle right in the middle of the foot. It originates here at the base, at the inferior portion of the calcaneus, underneath the calcaneus, in between the Abductor Hallucis and Abductor Digiti Minimi. So that would be around in this area here, or this area here of the calcaneus. And you can see how it extends out and into this insertion point at the phalanges, specifically on the middle phalanges of the toes from 2 to 5. And you can see how it kind of splits here and reaches the, and inserts right here on the middle phalange of digits, phalanges 2 to 5. So this muscle would look something like this. The origin at the base of the calcaneus here. At the sort of a dual insertion on these two, and of course makes it perfect for flexing those toes. If this muscle were to contract, your toes would curl underneath and sort of grab the floor. That's the action. This is the insertion, this is the origin, and then the action is to flex. Flex the digits, flex the toes, flex the phalanges. The next layer, the second layer of muscles in the intrinsic muscles of the foot includes, here's the second layer, the Quadratus Plantae and the 4 lumbricals. Talk about the Quadratus Plantae as this muscle right here. Deep, pretty deep into the foot here. And it is a very unique muscle because what it does is it originates here at the calcaneus, at the inferior calcaneus, and then actually joins up with this tendon right here of the flexor digitorum longus. And it jumps in and joins this tendon underneath, you can't see it, but underneath, and then winds up helping and assisting the flexor digitorum longus. So the flexor digitorum longus, which is an extrinsic muscle of the foot, which we've already talked about, wraps around the medial malleolus here, and originates on the posterior tibia. Like I said, wraps around the medial malleolus. It's joined by this Quadratus Plantae, which has its origins right here on the inferior calcaneus. So it's like two muscles merging, sort of merging into one. So what a brilliant design of the body to have this muscle here, right here, the flexor digitorum longus, which originates on the back of the tibia, joined by a more local intrinsic muscle to assist in this grabbing and pulling and clawing of the toe. So obviously the Quadratus Plantae, the function or the action is flexion, assisting in toe flexion. And these lumbricals are very interesting, odd little muscles, tiny little muscles. Just as the Quadratus Plantae is a strange muscle because it originates at the base of the calcaneus and then at the inferior calcaneus, and then it inserts into these tendons of the flexor digitorum longus. The lumbricals, these funny little muscles here, come off of the tendons, so they don't have an origin, a solid origin on a piece of bone. They come off the tendon. So the Quadratus Plantae inserts on the flexor digitorum longus tendon, while the Quadratus Plantae originates on from the flexor tendons. So these little muscles come right off the tendon of the flexor digitorum longus. And to make it even more interesting, where do they insert? Well, they insert at the base of the proximal phalanges, like right in here, 2, 3, 4, 5. But they also go around to the top of the foot and they insert on the extensor tendon of the foot. So imagine that. They insert here on the bottom of the proximal phalanx, which means they grab and pull and flex. Their action is to flex the toes, but also they sneak around and join the extensor tendons on the dorsum of the foot here, looking up, here, 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 and they also wind up extending the digits as well. So they flex the proximal digits, phalanges, and pull them down toward the ground, and then they simultaneously help with extending these little toes backward. So they flex the first joint here, they flex it down towards the floor, and then they extend these joints here. So the lumbricals, their job is to flex these forward, the proximal joints, and then to extend, flex the proximal joint forward and extend the distal joints backwards. And if you press onto the ground with your toes, you can see how that's possible. If you grab the ground with your toes and lean forward on your toes, you can see how you can flex your toes into the ground and simultaneously extend the distal phalanges. So very unique, the second layer with the Quadratus Plantae and the 4 lumbricals. Moving on to an even deeper third layer of the foot. We have the Flexor Hallucis Brevis. This muscle right here. And originating in this little spot right here on the plantar surface of the bottom of the foot, right smack in between the cuboid bone, part of the cuboid bone, and the third or the medial cuneiform bone. Remember, we have it's the lateral cuneiform. This is the medial or first cuneiform, second, intermediate, and then lateral over here. So it kind of shares an origin. And as you can see, it goes ahead and it inserts right here at the base of the first phalange of the big toe, of the great toe, of the first toe. And of course, what would its action be if it goes from here, the origin here to here? Going to flex this toe downward. Big toe flexor. Hallucis. Flexor hallucis brevis. Flexor flexes the big toe, the short muscle that flexes the big toe. Next, we have the Adductor Hallucis. It's this muscle right here. The Adductor Hallucis. And you can see its attachment here at the base of the second, third, and fourth metatarsals. And it inserts on the medial side or the inside of the base of the proximal first phalange. Of course, if we were to draw a line from here to here, what would it do? It would pull that toe where? Inward toward the midline of the foot. When you move anything toward the midline, it's called what? Adduction. Adduction. That's why it's called the Abductor Hallucis. Adduction means toward the midline. Abduction means away from the midline. So the Adductor Hallucis pulls and adducts the big toe inward from its origin at the base of the second, third, and fourth metatarsals and its insertion on the medial side of the base of the first phalange. And that's the Adductor Hallucis. Now, just as its name says, the flexor Digiti Minimi Brevis. What do you think it does? It flexes, minimi means small, the smallest digit or phalanx or toe, and it's a short little muscle. So here it is right here, the flexor digiti minimi brevis. You can see its origin here at the base of the fifth metatarsal. And then its insertion here at the base of the proximal fifth phalange. And you can see it runs from here to here. If it pulls this way, it's going to flex this big toe downward. Why it's called the flexor digiti minimi brevis. Now for the deepest layer, the fourth layer. These muscles are called Interosseei. Inter meaning in between. Ossei means bones, meaning between the bones. And as you look down here, in fact, you can see that these Interossei are in fact in between the bones, in between the metatarsal bones of the foot. These that I'm highlighting are the plantar Interossei here. Then these, strangely enough, are the dorsal Interossei. They're very close together, smashed between your metatarsals of your foot. So there are actually 4 dorsal Interossei and 3 plantar. So this is actually all dorsal Interossei here. And you can see by the diagram the job of the plantar Interossei, interosseous muscles, is to adduct the toes. In other words, they bring them in closer to the midline. And the job of the dorsal Interossei is to abduct the toes or take them away from the midline. The midline right here of the foot. So these little muscles in between the bones, interossei, are abductors and adductors of the toes. Their origin for both of them is right here along the all along the side of the metatarsal bones. And then, of course, they insert onto the shaft of the proximal phalanx of the toes. For the dorsal interossei, it's the toes as the second 2, 3, 4, 5. And for the plantar interossei, it's just 3, 4, and 5. Similar to the lumbrical muscles, these little guys also insert to the extensor tendon above here on the dorsal surface of the foot. So they also do a little bit of extension of the toes, and they also flex the toes, very similar to the lumbricals. So interesting, they abduct, they adduct, or at least the plantar Interossei. They abduct, they adduct inward, they flex the toes, and then they also extend the toes through attaching to this common extensor tendon. Interestingly, here's another look at the dorsal interossei wedged from the top, from the plantar surface, wedged between each of the metatarsals. And you get a good look at their insertion point on the shaft of the proximal phalanx. This concludes lesson on Anatomy Coloring Book, page 65. I'm Dr. Stephen Harkins.